Here's something you haven't seen during the summer of angry town halls.
You're welcome so much for coming to my home.
Oh, my pleasure.
A healthcare house call. Democratic Congressman Gerry Connolly at Susan Burton's table, invited to hear her explain why she may have to cut health coverage for workers at her small business.
$1,000 for family coverage. So that's the one we went with. That's outrageous for a group.
Connolly, a freshman, wants to back health reform but is wary because his Virginia district is fairly conservative. Afterwards, the congressman lamented that deep concern he heard here about the current healthcare system has been drowned out.
Why is public opinion turning against healthcare reform if you have stories like that?
Well, partly. We've had a steady drumbeat of the negative, playing on people's fears and anxieties, and to some extent that's clearly taken hold. This is the bill.
In a car ride through his district, Connolly blamed his own party, especially the president, for losing control of the debate.
The White House candidly underestimated the passion on the other side. I think we underestimated the ability of the opposition to really initially frame the issue in outlandish ways.
Connolly goes back to his district office to see Democratic groups scrambling to reframe the debate and get his vote.
That was the whole point of us getting people elected.
Members of a local union there to lobby him in one room, and in another, volunteers from the president's political group, Organizing for America, deliver a box of petitions and bring emotional stories of pre-existing conditions that make insurance unaffordable.
And I have to resign from my job because of my health issues.
Connolly says those meetings are effective, but back in the car, this Democrat with conservative constituents says what he really needs is better leadership from the president.
We need Obama to maybe put aside the cool cerebral part of himself. We need a more passionate Obama who can directly articulate to Americans why we need health care.
So Jenna Bash joining us now live from Washington. So which way now might Congressman Connolly be leaning?
Well, you know, as I said in the piece, he is from a conservative district, but he obviously is a Democrat, a new Democrat, who says that he was elected to do this. So he a health care overhaul this year. He wants to vote for something. But just like other House Democrats from conservative districts, he thinks that the House's bill right now taxes too much. He says it doesn't do enough to control long-term health care costs. And he told me that he really hopes the president next week doesn't necessarily just show more passion in public, but he really says it's critical for the president to engage more behind the scenes, Frederica. He said it's critical for him to start settling the disputes in their Democratic Party over things like a public option. And he wants the president to, as he said, roll up his sleeves and cut a deal.
Frederica. Dana Bash in Washington.